Okay guys, today we are going to talk about hypertension, of which this condition, which is not a new condition. We have heard about this condition now. I'm bringing this topic so that at least we discuss, and now we know, we do have ideas on how this hypertension occurs and what things should we consider as this hypertension is taking place in some other people. So let's look at the general objectives. So at the end of the lecture or discussion, students or you guys should be able to acquire knowledge on hypertension. Then the specific objectives at the end of the lecture or discussion, students or you guys should be able to outline briefly the anatomy of the heart and blood vessels, define hypertension, outline the classification of hypertension, state the predisposing factors of primary hypertension, state the causes of secondary hypertension, explain the pathophysiology of hypertension, state the signs and symptoms of hypertension, and there are many other specific objectives. But in this case, we'll maybe the discussion will be ended on the treatment, to describe the treatment of hypertension, which is number 9. Okay, so in an introduction, and again, the way it is, this is the blood disorder condition. This is the blood disorder condition. So at least you guys should have an attention, so that at least you understand how this hypertension comes about. And again, all you should know is all the blood disorders, they are related. All the blood disorders, they are related. So you may talk about anemia, you may talk about leukemia, you may talk about other blood disorders, including hypertension. You will find that most of the things will be the same. The difference is just the condition. So that's why I'm asking for attention, so that at least we do it together. So let's talk about hypertension now. So hypertension is a major risk factor to stroke. It is called a silent killer. You know, when there is this hypertension, when there is an elevation or sustained in blood, you may find that some vessels which transport blood to the brain may be ruptured because of the pressure, because of high blood pressure. So that high blood pressure can make someone to go in to develop what? Stroke, because the vessels that are able to transport nutrients or blood to the brain, they are no functioning because they have ruptured. So someone will have what? Stroke. That's why it is called a silent killer. And again, no one will tell that this is hypertension when you're walking. Everyone in the world has this condition, but you can only tell when you do some investigations. But normally, you can't say this is hypertension, this is whatever, because it's something that you can't detect just by seeing, unless you do some investigation. Okay, so here there is the diagram of the heart, anatomy of the heart, showing the parts of the heart. Why is this diagram in this topic or in this condition? Because we are saying there is heart which is pumping, or which is working as an engine to distribute what? Blood. And blood, for it to flow in those blood vessels, there must be something which is making blood to reach the extremities or to reach to other body organs. So the heart is here to make us understand how this blood flows and what happens to the heart for us to identify that this is hypertension. So that's the main thing why the heart is brought in this condition. So there is heart showing the parts, whatever. Hope by this time now you guys, you know, the blood circulatory system and all those things, so won't spend much time. Then that's the blood vessel. They are showing us the blood vessel because that's where blood flow. So the same blood vessel, you'll see it later, the same blood vessel can make someone to go in to have what? Hypertension, because of some interference. So there are things that the blood vessel itself can contribute to make blood flow at what? High pressure, of which someone will have hypertension. So there is this blood vessel telling us what will happen if maybe the lumen of the vessel is narrowed, or if the lumen of the vessel is widened, or maybe if there is anything there that has interfered in the normal function of the vessel. What will happen? It means someone will have hypertension. So we'll talk about it later. Then that's blood vessels. Then okay, so the definition of hypertension. Hypertension is a condition in which there is sustained elevation of arterial blood pressure. There is a condition in which there is sustained elevation of arterial blood pressure with systolic pressure over 140 and diastolic pressure of 90 millimeter of what? Mercury on at least 3 occasions. So sometimes hypertension can come about because of maybe the elevation in systolic, or maybe there is pressure in diastolic. So if systolic pressure is over 140, it means that hypertension is systolic hypertension. Then if it's over 90, then that hypertension is diastolic hypertension, according to which the elevation is of the same blood or the same pressure. So in a hospital setup, for us to come out with good confirmation, or for us to confirm that this is hypertension, we should do it at least for 3 times. Then if you are seeing that maybe the systolic and diastolic, they are increasing at each time you test, or you test or you observe the blood pressure, then for 3 times and above, you can confirm that this is hypertension, according to the ranges or the numbers that each pressure is giving out. Then we do have classification of hypertension. Classification of hypertension, we have grade 1, or sometimes we can call it mild or grade 1. So on this one, the systolic blood pressure is of 140 to 149 millimeter of what? Mercury. So 140 to 141 to 149, that's mild or grade 1. So when you are measuring, then you come out with this range of systolic. It means that person may have what? Mild or grade 1 hypertension. Then diastolic of 90 to 99, then that one is falling under what? Grade 1 or mild hypertension. Then we do have grade 2, moderate. That one should be above, should be in the range of 150 to 179 millimeter of mercury, and then diastolic of 100 to 109 millimeter of mercury. That's moderate. Severe, now we're saying severe or grade 3. It means now the ranges, they are in high numbers, they are in high records. Now you talk of hypertension, we talk of severe. For moderate, in systolic it was 179 as the maximum, but for severe it should be above that. Which is 180 millimeter of mercury. And then for diastolic, blood pressure of greater than what? 110 millimeter of mercury. And then you see this is severe hypertension, and for this one there must be immediate intervention, because someone may have stroke, like what we discussed on the preamble. Someone may have stroke, may have epistaxis, when these vessels on the nose may get ruptured. All those mount vessels, venous, whatever, arteries can be ruptured because there is now high blood pressure in the body, making these blood vessels not to accommodate the blood which is passing there, because they are not used at that pressure, of which for them just to survive, because of overloaded in blood, they'll be ruptured. And when these blood vessels ruptured, what will happen? They bring other complications. That's why it is called a silent killer. Someone may just die. We may just die without you realizing that it's hypertension causing this. So those organs where these blood vessels have ruptured, it means they won't receive any nutrients, they won't receive enough or adequate blood, so that can make them to stop functioning, and someone will develop complications, which is not bad, which is not good, which is not good. Then, so we have talked about the classifications of hypertension, which are 3 of them. We have grade 1 mild, we have moderate or grade 2, we have grade 3 or severe hypertension. Those are classes of hypertension. So we can classify hypertension on those areas according to the ranges that were recorded during blood pressure investigation. Then we do have types of hypertension. So under types of hypertension, we have primary or benign hypertension. It's also called essential hypertension. So it is called primary or benign or essential because on this one, the causes are idiopathy. They are not known. The causes are not known, but it's this hypertension that just develop without any cause, without you tell that one, that's the cause why there is this hypertension, but there is hypertension. So it's this type of hypertension where the cause is not known, but there is hypertension in someone. Then we do have secondary hypertension. When you say secondary, it means there was something before it happens, or there was something that has made that thing to happen. So in talk of secondary hypertension, it means there was things that contributed to that thing to happen. For example, on this one, the secondary hypertension, there are causes, and those causes, they make someone to go or to have hypertension. So it's high blood pressure related to identifiable causes. So in this one, you know the causes. Then we are done with types. So under hypertension, we will have 2 types: primary or benign or essential hypertension, where the causes are not known. Then number 2 is secondary hypertension, where we do have causes that contribute to have hypertension. Then let's talk about the predisposing factors to primary hypertension. So in talk of predisposing factors, it's these things now that can predispose someone to have hypertension. So we want to know what are these things that can predispose someone to have hypertension. Number 1, we may have genetic factors. Yes, so we find that those children with parents who have hypertension, they will inherit that gene of hypertension, of which in their generation they may experience hypertension in their family, because they inherited that trait of hypertension to their parents gene. So blood pressure tends to run in families, and children of hypertensive parents tend to have high blood pressure than age-matched children of people with normal blood pressure. So you find that these children who have parents with high blood pressure, they inherit that hypertensive trait or gene from their parents, of which in their generation they may experience this hypertension in their generation. So genetic factor is one of them. Then talk of obesity. You know, on top of obesity is this now where someone has more fats. So now on this one, bring the anatomy and physiology of the human body. Right? So there is these blood vessels, and we know where these blood vessels are attached to. So we find that if there is more fats in the body, they may accumulate the blood vessel. Making narrowing of what? The lumen of the blood vessel. Now, what will happen if there is narrowing of blood vessel? It means there will be high blood pressure. So now when that high blood pressure sustained, it will be in what? Hypertension, because of this accumulation of fats to the blood vessel. So it means blood will be moving at high pressure. Same applies when you are watering the garden with water pipe. Yeah? Then when you touch on plant there wabika kwa kamuntu kuntanchi kulyani, instead but for you to at least to increase the pressure, you would at least close slightly to the slightly kadakali tumbo, so that ameshambe kufumisha sana. So apply that practical in this one. So if there is accumulation of fats to the blood vessel, it means there will be increased blood pressure because the lumen will be narrowed. And again, the same fats, the same fats. Right? Sometimes you may have atheroma is this fat now which will occlude on the blood vessel. So you'll find that it will reduce the lumen of the blood vessel, making high blood pressure also, which can cause what? Hypertension. Alcohol intake, you know, the alcohol is highly concentrated. So when you take in alcohol, since it's highly concentrated, it will interfere the transport of oxygen and nutrients to the heart. It will interfere the transport of nutrients and the oxygen to the heart. Now what will happen? It means the heart now will sense, why some body organs, they are not receiving oxygen and nutrients. They are complaining, but I'm working hard. So what will happen? The heart will start pumping faster, so that to compensate that blood or that nutrients to those areas, because this process of distribution, the process of oxygen distribution have been interfered. So the heart will start pumping fast, so that to compensate. As it doing that, there is increase in blood pressure. And someone will have hypertension. So heart has to pump harder to supply nutrient-rich blood to the other organs of the body. It raises the drunkard's blood pressure. That's why you see those the drunkards, they have blood pressure, high blood pressure, because the chemical is highly concentrated, of which it interferes the distribution of nutrients and oxygen to the body organs and tissues. What will happen now? The heart, you see as if it's not working, so it start working hard, so that to compensate these things which are not reaching the vital organs. So someone will have hypertension. Then excessive sodium intake, you know, salt attracts water. So you find that if there is excessive now intake of sodium, what will happen? It means salt will draw water, bringing these fluids into the blood vessel, of which there will be congestion now. There will be congestion in the blood vessel, because it's this sodium which is bringing fluids from where they are into the blood vessel, and this will cause congestion in the blood vessel. Now what will happen? Since there is excessive fluids in the blood vessel, the heart will start pumping fast, so that to distribute these fluids or this blood to the all parts of the body. But since there is congestion, someone will have blood pressure. Then stress, so stimulation of the nervous system to produce large amount of vasoconstriction, adrenaline hormones that increase blood pressure. When you when you are stressed, maybe there will be this stimulation of the adrenaline. So when you are stressed, it means adrenaline will be stimulated, and when this adrenaline is produced or released from the adrenal gland, what will happen to the adrenaline hormone? This adrenaline hormone has a tendency of constricting the blood vessels. So when these blood vessels are constricted, it means they are increasing what? Blood pressure, because the lumen of the vessels will be narrowed, making blood pressure. Then smoking, this smoking, it has these toxic substances, which is nicotine and tar. So those toxic substances can harden the arteries or damage the blood vessels. When they are hardened or damaged, what will happen? It means there will be increase in blood pressure because of these toxic substance, which are nicotine and tar. Then age also matters, especially the older people. So due to their age, these cells, tissues, they will become weak. The cell differentiation will be slow. When it comes to cell division, when maybe they are injured, you'll be slow. So due to this age, it can predispose them to have hypertension. They may be hardening of blood vessels, and when the blood vessels are hardened, what will happen? Remember where we come from? We said the blood vessel or artery lumens will be narrowed, and when the lumens are narrowed, it means there will be increase in blood pressure. Then also, yes, atherosclerosis, this is the hardening of blood vessel. So atherosclerosis is hardening of blood vessel. Then atherosclerosis is this athero, it means fat, sclerosis hardening. So atherosclerosis, this is the accumulation of fat in a hardened vessel. Remember, the blood vessel is hardened already. Then if there is this fat which is accumulated in the blood vessel, it means the lumen will be narrowed. They will be narrowed, and when the lumen is narrowed, what will happen? It means the blood which will be flowing there will go under high pressure, and that can cause someone to have hypertension. So we are done with predisposing factors of primary hypertension, where we talked of alcohol, smoking, age, and all those predisposing factors that we have mentioned. Now let's talk about the secondary hypertension, the predisposing factors or causes of secondary hypertension. So we are saying on those predisposing factors or causes of primary hypertension, we said it's one where the causes are not known, but you just see someone developing hypertension. Then for secondary hypertension, it's one now where we can see or we can know the causes that are bringing the hypertension. So for this one, we have coarctation of the aorta. Coarctation of the aorta. It is a congenital stricture of the aorta resulting in increased resistance to the flow of blood through the vessel, and also increase the arterial pressure behind the stricture. So is this now the congenital stricture of the aorta? If maybe the aorta is not, maybe if there is any deformity in that aorta, it can contribute to hypertension, because the aorta is not distributing this blood normally in the general circulation because of any deformity on the aorta. So that can bring what? Hypertension. Kidney disorder. You know, kidney is one that regulates the fluids in the body. It's one that regulates the fluids in the body, and mostly that's where filtration of this blood takes place. Now imagine if there is any disorder to the kidney. So you find that if there is any disorder to the kidney, even if this blood comes from the heart, it won't be well supplied to the what? To the kidney. And what will happen? You know, there is this renin, the renin which will be produced when there is insufficient supply of what? Blood to the kidney. So there will be this renin which will be produced there. Thereafter, the liver will see now that the kidney is suffering, my friend is suffering. What should I do to make it easy? So the liver also produce a certain what? A certain enzyme to make this kidney survive, of which that renin will convert the angiotensinogen into angiotensin 1, of which this one is not capable of, it's not strong enough to make the kidney function well. Then there will be conversion of angiotensinogen 1 into angiotensinogen 2, until these vessels become constricted and tend someone to have what? High blood pressure. So in here they are saying any condition that reduces blood flow through the kidneys or destroys its parenchyma may lead to hypertension. For example, renal artery stenosis and nephritis lead to renin-angiotensin system activation, like what I explained. So it's this now, the kidney who is not supplied with enough blood. So what will happen? It will destroy its cells, parenchyma cells or tissues, this tissue of the kidney. So that tissue of the kidney will be destroyed, of which there will be production of renin. This renin will convert angiotensinogen into angiotensinogen 1, then angiotensinogen 1 will be converted into angiotensinogen 2, of which which will lead to hypertension. Because there isn't supply or good supply of what? Blood to the kidney. Then we do have endocrine disorders. So if tumor of the adrenal gland, the pheochromocytoma, which leads to increased production of adrenaline, which constrict blood vessel and hence increasing blood pressure. You know, endocrine system disorder now, you find that maybe the adrenal gland as the tumor. So that tumor will lead this adrenal gland to produce what? Adrenaline hormone, of which this hormone will constrict the vessels. And when the vessels are constricted, the lumen will be narrowed, making high blood pressure or raising blood pressure. Then, so these are causes of secondary hypertension we are talking about. Then the central nervous system. The vasomotor system may be destroyed by space occupying lesions like cerebral tumors, which may increase the intracranial pressure, leading to increased vasoconstriction and hence increase in blood pressure. Then contraceptive pills, estrogen content of the pill increases synthesis of angiotensinogen, which increases the levels of angiotensin, a powerful vasoconstrictor, which results in less blood pressure. The contraceptive pills, these people they take, so they have estrogen content. So this estrogen content is one that makes or it will stimulate the production of angiotensinogen. So when this angiotensinogen is produced, it will be converted into angiotensinogen 1. Remember from kidney disorder, it will be converted into angiotensinogen 1. This angiotensinogen 1 is not capable of constricting the vessels. So it needs to be converted again into angiotensinogen what? 2. So angiotensinogen 2 is very powerful such that it will constrict the blood vessels, making narrowing of the lumen, hence they will be raising blood pressure. Atherosclerosis, we have found this term, atherosclerosis. So atherosclerosis, we said, is a hardening of blood vessel. So if the blood vessel is hardened, it means there is also narrowed of lumen. Then atherosclerosis, we said atheroma is a fat. So there is thickening and hardening of the holes of the arteries, atherosclerosis, and the narrowing atherosclerosis of the blood vessel leads to a rise in blood pressure. There is hardening and narrowing of the lumen, making blood pressure. Have seen in the picture? So that's the normal vessel, Then atherosclerosis, you have seen there is hardening of the blood vessel, and you have seen the lumen now has changed its shape. It's narrow. You can't compare to that one. Then atherosclerosis, you have seen that yellowish color. Those are fats. Now they have compressed the lumen of the blood vessel, making it to be narrowed. Now imagine if there is blood flowing there. So it means the blood will raise in pressure so that it pass. So that's how. So we are done with the predisposing factors of secondary hypertension. So let's now talk about pathophysiology. Pathophysiology is something that is very easy to understand or to write when maybe you are given, or you want to explain about a certain condition. Pathophysiology is one that is very easy to understand. So the most important thing on this one, you must know what this condition is, then what causes that condition, then what will happen when that condition, or what will happen when that causative agent cause, what are the signs and symptoms. So that's under pathophysiology. That's just the nature of this condition. How did it started? What happens for it to start? What things does it cause when a certain condition comes? So that's under pathophysiology. So pathophysiology is saying arterial blood pressure is a product of cardiac output and systolic vesicular resistance. So arterial blood pressure, or the blood pressure, is a product of cardiac output and systemic vesicular resistance. So on everything, for example, even the vehicle, for it to move from one place to another, there must be resistance. That's friction in physics. There must be a resistance. So for the vehicle to move from its point to another, there must be resistance. That's why we are saying this blood pressure is a product. So product in mathematics is multiplication. So the arterial, or the blood pressure, is a product of cardiac output, the blood which is ejected from the heart every minute. That's cardiac output. And systemic vesicular resistance. Vesicular resistance. So when you get cardiac output multiplied by the systemic vesicular resistance, you get what? High blood pressure. So that's a formula. So high blood pressure is equal to CO, or cardiac output, multiplied by CVR, or systemic vesicular response. So you get what? High blood pressure. So have that one in mind. And I think for this stage, we can write somewhere. High blood pressure is equal to cardiac output multiplied by systemic vascular response. We want to know what will happen now, what comes out, or what makes high blood pressure. So have that picture in mind, or write that formula somewhere so that when we are discussing, we will relate it to the formula. So any factor that affects cardiac output or systemic vascular resistance can lead to an increase or decrease blood pressure. Remember from the factors, the predisposing factors that we are from talking about. So we have high blood pressure is equal to cardiac output times what? Systemic vascular resistance. So we are saying any factor among those that we have discussed, any of those. So if any factor affect the cardiac output or the systemic vascular response, it means there will be this interference, and the same interference can lead someone to have high blood pressure or low blood pressure. For instance, if there is interference in cardiac output, it means the blood which will be flowing in these vessels will be under high blood pressure, because will be under high blood pressure, or maybe will be under low blood pressure. If there is any interference affect the cardiac output, or maybe in other way around, if there is any interference affect the systemic vascular resistance, someone may have low blood pressure or high blood pressure, according to which, or maybe there is interference on both the cardiac output and the the systemic vascular resistance. Someone will have low blood pressure or high blood pressure. It depends on the factor that has affected those areas. Then, the regulation of blood pressure is a complex process involving nervous, cardiovascular, renal, and endocrine function. You know, these are systems now that regulate the blood pressure. There must be nervous. You know, on top of nervous system, that's where there are those hormones that work under nervous system. Maybe for them to be active, there must be stimulation from the nerves. Then cardiovascular system, you know, there is heart now. There is heart and the vessels which work together for them to distribute this blood to other parts of the body. There is renal. We talked about kidney. That's where there is filtration of this blood, and again the kidney is one that regulates this blood in the body. Then talked about endocrine. You know, there is this hormones like adrenaline, which is secreted by the adrenal gland. It's also regulate the blood pressure. So all these systems, they regulate the blood pressure. So imagine now, if there is reduced blood supply to the kidneys, this can lead to production of an enzyme called renin by the kidney. So understand this. So if there is reduced supply to the kidney, reduced blood supply to the kidneys leads to production of an enzyme called renin by the kidneys. So this renin will come out because there is low supply of blood to the kidneys. Now what will happen after renin is produced? So this renin will convert the plasma protein angiotensinogen to angiotensinogen 1. So when that renin is produced, it will convert the plasma protein, which is the angiotensinogen 1, the angiotensinogen to angiotensinogen 1. Then this angiotensinogen 1 is not that capable of which such that it can operate well, but it has to be converted again into powerful enzyme. So the angiotensinogen 1, or the angiotensin 1 is then converted to angiotensin 2 by angiotensin converting enzyme. So the angiotensin converting enzyme is an enzyme that is produced by the lungs. Remember, we are saying there is these systems that work together to operate or to regulate what? Blood pressure. So the lungs, which is under the respiratory system, the lungs will produce the angiotensin converting enzyme, which will convert the angiotensin 1 into angiotensin 2. So what will happen now if there is this angiotensin 2? It means there will be increase in blood pressure because there will be vasoconstriction, making a rise in blood pressure. Then vasoconstriction, so that angiotensinogen, angiotensin 2, there will be vasoconstrictions resulting in increased vesicular resistance and hence increase in blood pressure. That promotes secretion of aldosterone, which promotes reabsorption of sodium. So after there is this conversion of angiotensin 1 into angiotensin 2 by angiotensin converting enzyme, there will be also production of aldosterone, which will promote the reabsorption of sodium. And we say sodium or salt has tendency of retaining fluids from where they are or to where they are. They have tendency of they have habits of not staying alone without fluids. So they seem like they are bosses in the body, because even if they go somewhere in the body, still fluids will follow until they are attracted. So now there is this aldosterone, which will promote the reabsorption of sodium. Then sodium inhibits fluid loss. Yes, sodium inhibits fluid loss, thus increasing fluid accumulation. This leads to increase in blood volume, increasing the cardiac output, and so raising the blood pressure. That's what we said in the preamble. The sodium has tendency of retaining fluids. Now imagine this sodium is in bloodstream, so it means even those bloods, even those fluids which are to the tissues, in the tissues, will follow where there is sodium, because it's excess there. So follow where there is sodium, and when this fluid starts to follow where there is sodium, there will be congestion in the blood vessel, of which the heart will start pumping harder so that to distribute these fluids or blood to other parts of the body, and hence they will be raising blood pressure. So from what we have discussed, we can talk about, we can have the picture with the system, the signs and symptoms comes. We talked about the kidney, talked about the endocrine system, talked about main things that happens when there is hypertension. So from that we can draw the signs and symptoms. So we do have signs and symptoms, which is suboccipital headache due to poor oxygen supply to the brain. Remember, in an introduction, we said someone may have what? Stroke. May have stroke if the hypertension is prolonged. May have stroke because there will be ruptured what? Blood vessels, of which the brain will stop receiving adequate nutrients and oxygen. So if this hypertension is prolonged, someone just feel occipital headache due to poor oxygen supply. Maybe the vessels, the arteries that supply oxygen and blood to the brain are ruptured. Then there will be raised blood pressure over a long period of time. We talked about this. Maybe it's kidney disorder, where the blood is not supplying the kidney with good nutrients. So there will be that process that happens, and there will be raising blood pressure. Then someone will have just feel fatigue due to reduced tissue perfusion. The organs or tissues, they are not receiving enough oxygen so that to convert it into energy, but due to that someone will have fatigue. Then irritability due to hypoxia, when there is a limitation in the blood supply to body organs or tissues, someone will just have just be irritable. restlessness and disorientation due to inadequate blood supply to the brain, visual disturbances due to rupture of retinal blood vessels. This rupture comes about because there is this high blood pressure which is not normalized, so some will just have visual disturbances because it can rupture the retinal blood vessels. Epistaxis, this is the bleeding in the nose where the vessels, the blood vessels in the nose are ruptured, so someone just be bleeding because there is rupture of these blood vessels in the nose. Then convulsions, and paralysis due to rupture of blood vessels in the brain. This is the convulsion. When we talk of convulsion, is just the contraction, rapid contraction and relaxation of these involuntary muscles without any external stimuli. They'll be contracting rapidly these involuntary muscles, so someone will just have convulsion. Then paralysis, maybe the body parts, they are not receiving enough oxygen and some other nutrients, so they will be paralyzed because they depend on those elements or nutrients. They depend on blood. Now if there is short blood supply to this, there will be paralysis. Then cardiomegaly due to overworking of the heart. Let's take for instance, this heart is used to pump blood at normal pressure. So if there is these factors maybe have interfered the cardiac output or systemic vascular resistance, so the heart will start pumping fast. The heart will start working hard. So by doing that, remember that heart is just a muscle, so there is probability that it's possible that the heart can increase in size. So the heart will still be pumping faster. So the muscles now will start adapting to that pumping action of the heart. At the end, the heart will start enlarging in size, where there will be hypertrophy. When you talk of hypertrophy, this is the increase in the increase of muscle, maybe. Yes, so the heart will increase in size. Then the cells, there will be multiplication of cells there for the heart to adapt to that pumping action, which is hyperplasia, the increase in the number of cells. Yes, then there is increase in the size of cells, which is hypertrophy. So there will be cardiomegaly, the increase of the heart, the enlargement of the heart. So those are the signs and symptoms, and others you can find, you can search. The investigations, there's blood pressure, you check for blood pressure, do chest x-ray. So when writing the condition on exam, to every point you come with, you should write a rationale. Why are you doing that? So like when you say check blood pressure, so why are you checking blood pressure? That's an investigation. It's part of an investigation. So you check blood pressure so that to have clear picture of finding out if it's moderate. Remember, if it's moderate, severe, or mild hypertension. So when you check blood pressure for at least 3 occasions, then you classify what type of hypertension in that one. Then you do chest x-ray. This will show up the internal organs. So we have talked about the cardiomegaly. So we are doing chest x-ray to rule out what? Enlargement of the heart, or to check for enlargement of the heart. Then blood for urea, urinalysis. While doing urinalysis, you remember there is this kidney. That's where there is excretion of these fluids. So do urinalysis to rule out kidney failure. So you are doing urinalysis to rule out your kidney failure. Fundoscopy, which may reveal papillary edema or ruptured retinal vessels. Then medical treatment. So under medical treatment, you have different types of groups which are given in combination. So we have different drugs from different groups, but they are usually given in combination. So the first one, remember we are saying mostly for hypertension or for someone to have high blood pressure, it means these vessels, they have narrowed. So what should be the first treatment is to dilate these blood vessels so that blood is free, this blood is free to flow and being supplied to other body parts or organs or tissues. So the first thing is to dilate vessels. That's why I'm saying the first medical or the first drug is vasodilators. So vasodilators, we have hydralazine. Hydralazine is a vasodilator. So this one will reduce blood pressure by direct arterial vasodilatation. Remember, the blood vessel is narrowed, making this blood pressure. But when the blood vessel is dilated, it means the blood pressure will be reduced because there is nothing now to interfere the flow of blood. So the action of vasodilators is to reduce the blood pressure, hence dilating the vessels. So it's used to treat for severe hypertension. So hydralazine you can use to treat severe hypertension, which should be administered through IV or oral. Then the dosage is 500 milligrams IV, slow over 20 minutes or 25 milligrams per oral. So when administering drugs, injectable drugs, don't administer the drug fast as you can. You kill the patient. So administer the drug slowly. You are giving that drug direct into the vein, of which there will be these effects can show up early because you are giving it direct into the vein. So when you give it fast, it means you interfere the normal function of that drug in the blood. Maybe you can, there are many things that can happen because you are giving it direct into the vein. So just give it slowly to prevent some complications that may come out. Maybe the patient can die. Then side effect: headache, nausea, tachycardia, and dizziness. Remember, that's why you give it slowly. There is tachycardia here, the rapid heartbeat or heart rate, rapid heart rate or heartbeat, called that's tachycardia. So these are the side effects: headache, nausea, tachycardia, dizziness. Then nursing implication: check blood pressure before giving the drug, as it reduces the blood pressure quickly. Remember, we said this one has the effect of reducing the blood pressure, making the dilatation of the vessel. So before you give, first check the blood pressure. If it's low, don't give, but if it's high, it's good, you can give. So that's the nursing implication of this drug. So first check the blood pressure so that not to make the patient go into hypotension. So check the blood pressure. If it's low, don't inject, but if it's high, inject because it can lower the blood pressure test. Then we have beta adrenergic blockers. So beta adrenergic blockers, for example, Andelo or propranolol. Propranolol is a beta adrenergic blockers. The action is to reduce blood pressure by antagonizing beta adrenergic effects, thus counteracting vasoconstriction, also reduce renin secretion by the kidney. So the beta or the propranolol is a drug that inhibits the secretion of or the production of renin. Remember that renin is one that stimulates that is contributing to raise blood pressure. So when you administer propranolol, it means it will inhibit that production of renin enzyme, of which there won't be constriction of blood vessels, bringing what? High blood pressure. So this one inhibit that, so that to maintain the blood vessel, the blood pressure. Also it reduces it contributes to vasodilatation. Route its oral dosage 10 to 20 milligrams TDS. Side effects: tachycardia, headache, palpitation. So the side effects may be same sometimes. So nursing implication: give drug with meals. So this one you can't administer without the patient eating something, but advise the patient to take a meal before taking the drug, because it can maybe deplete all the glucose in the body, the blood sugars in the body, and the person will have hypoglycemia. So at least they encourage the patient to eat, so that there is good number of blood sugars in the body, which will work on the drug when metabolic is taking place, because there will be increase in metabolic reaction. If the patient doesn't eat anything, it will deplete all the glucose levels in the body, and the patient will have hypoglycemia, which is not good. Then angiotensin converting enzyme inhibitors. So these are the drugs now, like captopril. Captopril is a drug that is given to inhibit that process of converting the angiotensin, remember, there in the kidney. So captopril will be given to inhibit that process, so that there isn't vasoconstriction. So the action here inhibits conversion of angiotensin 1 to angiotensin 2, thus minimize vasoconstriction. So captopril will be given to inhibit that process, and there won't be vasoconstriction, and this will promote what? Normal blood pressure. Route its oral dosage 25 to 50 milligrams BD or TDS. Then calcium channel blockers. So calcium channel blockers, it's nifedipine. So nifedipine, so far I've talked about captopril, propranolol. Yes, captopril, propranolol, and nifedipine, which is the calcium channel blockers. So this one blocks the movement of extracellular calcium into the cells, resulting into vasodilatation. Routes IV dosage 10 to 20. Then loop diuretics. Loop diuretics, for example, furosemide, inhibit reabsorption of sodium chloride in the ascending loop of Henle. So loop diuretics is like furosemide is the diuretic drug. This one will inhibit the reabsorption of sodium chloride in the ascending loop of Henle. It can be given intravenously, intravenous, or IV, or oral. The dosage 20 to 40 or BD. Side effect: fluid and electrolyte imbalance. Nursing implication monitor. So all these are drugs. The potassium sparing, diuretics, analgesics. This patient is in pain, so we need to relieve pain. So you give analgesics, for example, paracetamol, which will block the generation of pain. So when you give paracetamol, it will go direct to the pain receptors, of which it will block the pain receptors, so that there won't be that transmission of pain. It will inhibit the prostaglandin. This prostaglandin it makes someone to have continuous pain, but when you administer analgesics, which is paracetamol, it will inhibit the production of prostaglandin, of which the pain will be relieved. Yes. Also inhibit the hypothalamus from appreciating the sensation of pain. So the analgesics also will inhibit it will tell the hypothalamus, more like it will make the hypothalamus to become dormant, so that even if this impulse from the receptor may transmit the impulses of pain, that hypothalamus won't interpret it into pain, to be dormant. So it will stop receiving the pain sensation because it is inhibited by the paracetamol. Dosage 1 milligrams TDS root, the root swallow. Then next implication, avoid long-term use as it causes liver damage. So paracetamol is very dangerous. Paracetamol is very dangerous because it can damage the liver. So avoid, even those who have tendency of taking paracetamol for no reasons, please stop. It can damage the liver. It can damage the liver. So we have, okay, so far at least we can end here, because for the next care plan we'll do it next, but for so far we can end here. At least we have discussed. So according to what we have discussed, at least 1 or 2 things have been picked from the discussion. So hypertension is a condition that is not easy to understand, because we do go there in the hospital, observe, do vital signs. So since we at least learn something on this one, we'll relate it to hospital setup now, practical. So let's summarize the same condition. So summarizing on summary, I'll just use the objectives. So we have looked at the anatomy of the heart and the blood vessel. So the heart and the blood vessel, the heart and the blood vessels, they work hand on hand for good supply of blood to these parts of the body. So we need to know how to draw the heart, what happens in the heart when blood enters there, what things are involved for the blood to be distributed in the body. Then we have defined hypertension as an elevation and sustained blood pressure is the arterial blood pressure, which is elevated due to some other factors. There may be systolic hypertension or diastolic hypertension, or both. That's a hypertension. Then classification. Under classifications, we talked about the grades, which is grade 1, grade 2, grade 3, and they have their ranges which you can use to classify the phase, or you can classify hypertension in like mild, moderate, and severe, and these they have their own ranges. Then we talked about the predisposing factors of primary hypertension, when we talked about the age, the alcohol, smoking, all those things we talked about there, predisposing of primary hypertension. Then for secondary hypertension, we talked about coarctation of the aorta, kidney disorders, and main things there. Those are the secondary predisposing factors of secondary hypertension. Then the pathophysiology, the concern here, under this one we said arterial blood pressure is a product of cardiac output and systemic vascular resistance, of which I give an example. For a vehicle to move from one point to another, there must be friction on the ground. That's a resistance making the vehicle to move. Same in the body. For this blood to move or to be distributed from the heart to other body parts, there must be resistance. the resistance. Now, if there is any interference on these two, the cardiac output and the systemic vesicular resistance, if there is any interference, it can bring what? Raise blood pressure in the vessels, making hypertension or blood pressure. And we said when there is low blood supply to the kidney, what will happen? The kidney will produce the renin, of which this renin will convert the plasma protein, which is the angiotensinogen, into angiotensin 1, and later on the angiotensin 1 will be converted into angiotensin 2 by the angiotensinogen converting enzyme, which were produced by the lungs, and these have the tendency of constricting the blood vessels. Hence they will be narrow lumen, bringing blood pressure, because the lumen is narrowed now. And again, as this angiotensinogen converting enzyme is producing from is being produced by the lungs, there will be also this aldosterone, which will be stimulated by the angiotensinogen converting hormone, which will play a role of also in bringing the blood pressure also, because there will be this sodium which will be reabsorbed in the bloodstream, and when this sodium is reabsorbed in the bloodstream, it has the tendency of bringing fluids from where these fluids are stayed into the bloodstream, making or bringing congestion in the blood vessel, and this will make the heart to start working hard. Hence there will be raised in blood pressure. And again, and as this heart is pumping, the muscles now start they will start adapting to that pumping action. As the result, there will be cardiomegaly. The heart will be increased in size, which is hypertrophy. Then the cells also, they will be increased in size. There will be rapid multiplication of the cells, which is the hyperplasia. So hypertrophy comes about because there is a hyperplasia, and when there is a hyperplasia, it means there will be increase in the size of cells, which the heart will enlarge, which is the cardiomegaly. So that's an explanation I can give under this one. Then the signs and symptoms, we have looked at the signs and symptoms. The occipital headache, there will be fatigue, there will be body malaise, there will be chest pain, there will be chest pain and other signs and symptoms. The investigations, under this one I said, as you are investigating, each point you come across with, give a rationale so that the marker knows why are you doing that, or what's the rationale of you investigating. Then treatment, we talked about the captopril, propranolol, we talked about potassium sparing, diuretics, all those drugs we have discussed. So these are the things that we can do right now, maybe. So at this point we end here. So thank you very much, guys, for your attention. Make sure that you understood this. Ask questions through WhatsApp group that you have formed. Ask questions from any person you come across with. You can ask questions from anywhere, as long as you understand. This is the common condition that we need to understand as health workers. So ask questions, add more information. Apart from this, add more information, so that even me who is presenting get the content from the condition. So add more information, teach through the WhatsApp group that we have formed. You can post there so that at least everyone in there gets the information. Then you guys, I do have the YouTube channel. Remember to subscribe and place on the notification ring there so that you always get notified when I post the new video. So I'll be doing this so that we help one another. Thank you very much for your attention, guys. Have a blessed time.